Sickle cell disorder, or SCD, is a genetic blood disorder. It affects red blood cells and oxygen transportation. This causes extreme pain, episodes of anemia, and organ failure. Sickle cells are much different in shape and make your blood prone to become sticky and stiff, reducing blood flow. SCD occurs from a mutation in the HBB gene on chromosome 11 and produces abnormal hemoglobin. The allele for this disorder is called HBS. It is inherited from autosomal recessive trait, meaning you must have both copies of HBS from each of your parents to be affected by it. Those who have one HBS and one HBB are carriers. It is generally diagnosed very early through newborn blood screening and hemoglobin testing like electrophoresis. Electrophoresis is a technique used to separate molecules based on their size and electrical charge. In the context of sickle cell disease, hemoglobin electrophoresis is used, a blood sample is placed on a gel, and an electric current is applied. Different types of hemoglobin, such as normal hemoglobin A and sickle cell hemoglobin S, move through the gel at different speeds. This creates a visible pattern that allows scientists and doctors to identify whether a person has normal hemoglobin, sickle cell trait, or sickle cell disease. This disease blocks your blood flow, leading to chronic anemia and fatigue, severe pain episodes, high risk of infection, and even possible organ damage over time. This leads to an average lifespan of about 54 for people who suffer from SCD. Sickle cell disease is autosomal, meaning it's not connected to sex. However, it is much more common in Africa because of its connection to malaria. In regions where malaria has been widespread for thousands of years, people who carry one copy of the sickle cell gene, called sickle cell trait, have partial protection against severe malaria. Because these carriers were more likely to survive and have children, the sickle cell gene became more and more common in the population over time through natural selection. This chart depicts the mortality rates of sickle cell disease. As we can see, it is most concentrated in sub-Saharan Africa near DRC and the equator, with mortality rates as high as 40 to 61 people per every 100,000. Medications like hydroxyurea are useful for treatment. However, hydroxyurea is actually a chemotherapy medication that's useful for cancers like leukemia, but also increases your blood flexibility by increasing fetal hemoglobin production, making it a useful medication if you want to lessen the amount of blood transfusions you need for SCD. Speaking of other treatments, of course, blood transfusions, which transfer different blood into you, which wouldn't have SCD. Also, because of its vulnerability to infections, getting vaccines and proactively taking antibiotics to prevent infections can help lessen that. Now talking about genetic technologies, stem cell transplants are really useful. Stem cell treatment for sickle cell disease, also called a bone marrow transplant, aims to replace the patient's faulty blood-forming cells with healthy ones so the body can make normal red blood cells. First, the doctors find a matched donor, which is often a sibling or close relative. The patient then receives conditioning treatment, like chemotherapy or sometimes radiation, to reduce the amount of their own damaged stem cells. Next, healthy stem cells from the donor are infused into the patient's bloodstream, where they travel to the bone marrow and begin producing normal hemoglobin instead of sickle cell hemoglobin. If successful, this can cure sickle cell disease by stopping sickling and preventing future pain crises and organ damage. However, stem cell treatment still has risks. Finding a suitable donor can be difficult. The conditioning treatment is intense, and complications like graft versus host disease can occur. Graft versus host disease is almost the opposite of what you'd expect to happen, when it's actually the donor's immune cells, the graft, when they recognize the patient's body as a foreign object and begin to attack it. This most commonly affects skin, liver, and the digestive system. Also, there's gene therapy options like CRISPR-based technologies that use RNA and the Cas9 enzyme to actually change your DNA. Regarding ethical concerns, one major issue is access and cost. Advanced treatments like gene therapy and stem cell transplant are extremely expensive and mostly available in high-income countries, even though sickle cell disease is most common in lower-income regions. This creates global health inequalities. There are also ethical concerns related to prenatal and carrier screening. While these tests help families make informed decisions, they may lead to pressure around reproductive choices or stigma towards individuals living with the disorder. Genetic privacy is also another concern, as people may fear discrimination by employers or insurance companies based on their genetic information regarding things like life insurance and long-term positions in a company. In the future, genetic technologies may greatly improve the diagnosis, treatment, and prevention of sickle cell disease. Scientists are working to make sure gene therapy is safer and more effective and more affordable, which could allow many more patients to receive successful treatment. Earlier and more accessible genetic screening could help diagnose a disease sooner and support better long-term care. That brings the conclusion to my video. I hope you guys all enjoyed and learned something new.